Good morning. Welcome to part 5 of nursing practice questions and answers about risk conditions related to pregnancy. Now let's start with the first question. The clinic nurse is performing a psychosocial assessment of a client who is pregnant. Which assessment findings indicates to the nurse that the client is at risk for contracting HIV? So select all that apply. So these are the options. Option A, the client has a history of intravenous drug use. Option B, the client has a significant other who is heterosexual. Option C, the client has a history of sexually transmitted infections. Option D, the client has had one sexual partner for the past 10 years. Option E, the client has a previous history of gestational diabetes mellitus. The correct answer for this question is option A, the client has a history of intravenous drug use, and option C, the client has a history of sexually transmitted infections. Now let's move to the rationale. HIV is transmitted by intimate sexual contact and the exchange of body fluids, exposure to infected blood, and passage from an infected birthing parent to the fetus. Clients who fall into the high-risk category for HIV infection include 1. Individuals who have used intravenous drugs. 2. Individuals who experience persistent and recurrent sexually transmitted infections. And 3. Individuals who have a history of multiple sexual partners. Gestational diabetes mellitus does not predispose the client to HIV. Also, a client with a heterosexual partner, particularly a client who has had only one sexual partner in 10 years, does not have a higher risk for contracting HIV. Now let's move to the second question. A client in the first trimester of pregnancy arrives at a healthcare clinic and reports been experiencing vaginal bleeding. A threatening abortion is suspected, and the nurse instructs the client regarding management of care. Which statement made by the client indicates a need for further instruction? So these are the options. Option A, I'll watch to see if I pass any tissue. Option B, I will maintain strict bed rest throughout the remainder of the pregnancy. Option C, I will count the number of perineal pads used on a daily basis and note the amount and color of blood on the pad. Option D, I will avoid sexual intercourse until the bleeding has stopped and for 2 weeks following the last episode of bleeding. For this question, the correct answer is option B. I will maintain strict bed rest throughout the remainder of the pregnancy. Now let's move to the rationale. Strict bed rest throughout the remainder of the pregnancy is not required for threatening abortion. The client needs to watch for the evidence of the passage of tissue. The client is instructed to count the number of perineal pads used daily and to note the quantity and color of blood on the pad. The client is advised to curtail sexual activities until bleeding has ceased and for 2 weeks after the last evidence of bleeding or as recommended by the healthcare provider. In my presentation, my reference book have used Saunders Comprehensive Review for the NCLEX RN Examination 9th edition.